The indications for referral are patients who demonstrate progression of symptoms in the presence of heart failure. So patients who are identifying as having heart disease, and we understand that their hearts are failing, those patients should seek specialty cardiologists initially who are part of a heart failure team. Those physicians can help us complete an evaluation, help with the medical therapies, and participate in the ongoing referral for mechanical support should that be necessary. Those patients are typically admitted to the hospital. And when they're in the hospital, they're seen by a variety of physicians and specialists. They're seen by the advanced heart failure team. They're seen by the ventricular assist device coordinators. And then they're seen by all of our consultants, which include our infectious disease experts, our gastroenterologists, our social workers, our palliative care experts. And after an evaluation has been completed by our multidisciplinary team, we have a discussion about the suitability for this technology. And then we rediscuss the options with our patients and our expectations for them and their expectations for us. Well, there's a variety of tests that we do. Some of the basic tests that are important early on are an echocardiogram. That gives us an idea of how the heart is functioning. It tells us how the valves are working around the heart. In addition to that, a variety of other imaging tests may be required. We may need to look at the circulation of the heart. We may do specialty tests to see if the heart muscle has turned to scar or not. We'll do images to see if the lungs are functioning properly. From the time that the patient is deemed a candidate and their medical condition is optimized for the application of this technology, the overall length of stay is probably close to a month until they're rehabilitated, they're educated, and they're comfortable caring for this technology at home. So the survival rates depend on the reasons that we're putting it in and the clinical condition of the patient at the time the VAD is implanted. But for the most part, as the technology continues to improve, the survival rates are approaching the survival rates of patients who undergo primary transplantation. So the 1 and 2 year survival continues to significantly improve, with the overwhelming majority of patients doing well. Rush has received many accolades. It's an incredible institution. It's an institution of learning. There are a number of outstanding physicians, allied healthcare professional, nursing, who are dedicated to the care of the patients. And that's reflected in the awards with which the institution receives. And it's a privilege to be a part of it. DMV accreditation requires processes and accountability for the application of this technology. We go through a rigorous evaluation by the accreditation body, DMV in this circumstance, and they evaluate what resources we have, how we provide those resources, and what processes we use to help care for the patient. Those are important to help us evaluate our program and be critical of ourselves to make sure that we're providing the most outstanding care for our patients. We have a great team of people that we work with, and through that team, we can almost immediately transform the life of a patient. Someone who is critically ill, who can't do anything, who has multi-system dysfunction, we can apply a technology that changes their life immediately and we see that right away. And to see that patient and just the thanks that that patient has is so incredible. It's just such a great thing to see. To be able to help someone in that capacity is really something special.